So you're talking about omega-3s, which is a good concept to explore a little bit. A lot of people think that the degree of inflammation that we experience and some of the deteriorating elements in our physiology reflect a change in the proportion of fats in our diet, and that the omega-3s are that fat that was a much more healthy one, and that we are throwing it out of balance in the way we eat. Any thoughts on omega-3s and omega-6s and that ratio?
Well, the easy way to look at it is the body has certain fats or fatty acids that are anti-inflammatory, and there's a group that are pro-inflammatory, and we need both. So why would you need something that actually causes inflammation? Well, it's important to heal. It's important to, as almost like as a life-saving thing. If suddenly you cut yourself and you were bleeding, all of the processes that help stop the bleeding are pro-inflammatory. So we need a balance between the two. When the pro-inflammatory, as opposed to the anti-inflammatory processes, get too dominant, that's when all the chronic diseases start occurring. That's when inflammation actually starts to occur, that microinflammation we're talking about. So with that, it's the omega-3s, fish oil, and within the fish oil, there's something called EPA and DHA. So when there are specific types of omega-3s. These are anti-inflammatory. So what do? They prevent all those things that occur when inflammation starts. They kind of put out fires. So basically, the source is mainly fish. There are some plant sources of the omega-3s. The omega-6s are characterized as being in the family of arachidonic acid, and so you can actually look at the ratio of the omega-6s, say the arachidonic acid family of omega-6s versus the omega-3s, and make a ratio, the arachidonic acid to the omega-3 ratio. And when you look at epidemiology around the world, countries, societies, cultures, when you look at their ratios, let's say a ratio of 1.5, and that's what you see like in Japan. And Japan has much less, the Japanese have much less of the chronic diseases that we have. The Eskimos have an arachidonic acid to omega-3 ratio of 0.8. Now in Europe, the average is 10. And in the US, that ratio is 20. In other words, in the United States, the standard American diet produces excessive inflammation. We are eating an inflammatory diet. So that's the link between the fast foods, the trans fats, the highly processed foods that stimulate insulin. All that goes into creating this inflammation and this imbalance between the omega-3s and the omega-6s. So fish oil or omega-3s, there's hundreds and hundreds of scientific articles on diverse benefits from brain function, bone function, heart function, circulatory function, neurological function, and it has to do with suppressing specific disease processes in those organs. So for seizures, omega-3s are used. For preventing heart attacks, lowering the triglycerides, raising HDL cholesterol, very diverse. And so it again tends to show you the relationship between a lot of these processes that lead to disease, like cholesterol problems, and the suppression of inflammation.
Interesting that you're talking about it as a ratio, and of course, what's the American way? Well, let's not mess with my intake. Let's just increase the ratio by taking a supplement. And is that really an effective way of looking at it? So, in other words, if my ratio is 20 instead of the 0.6, like it should be, if I just add more omega-3s and increase my ratio, is that really the way I want to do it?
Right. So what you're saying is if you're eating a lot of fast food hamburgers and it creates this bad ratio, you could add omega-3s, but you'd probably be better off getting rid of the fast food hamburgers. I agree with that. Okay. But after that's done, you still could have a ratio. Maybe it's genetic. Maybe there are other factors. There's a lot of other factors that may dominate the reason why you have a particular ratio. So part of anti-aging medicine is to look at that ratio and to help people, as consultants, to make a recommendation that maybe they should take these supplements.
Vitamins.